Welcome to Showcase Richmond. I'm Matt DiNardo. Although cancer strikes millions of Americans every day, more and more people are surviving this dreaded disease, and that's due to improvements in research, detection, treatment, and events that increase awareness, like Women and Wellness, an event hosted by VCU Massey Cancer Center. And the important work being done at VCU Massey Cancer Center and what women can do to arm themselves against cancer is the focus of today's Good News segment, made possible by Care Advantage, changing our community one charity at a time.
Care Advantage means that I can face each day with a positive. You don't have to go to bed at night wondering, how am I going to get through tomorrow? Because you already know they will be here to help you get through that day. They care about the people they're helping. They're special.
Don't do it alone. Call Care Advantage and find the peace of mind you've been searching for.
And with us now is Dr. Mary Helen Hackney, an associate professor in the Division of Hematology and Oncology and the Department of Internal Medicine at VCU Massey Cancer Center. Welcome to Showcase Richmond.
Thank you for having me.
Let's start off by talking about your role at VCU Massey Cancer Center.
Well, I've been part of VCU Massey Cancer Center now for 20 years, and I have several primary roles. One, I'm one of our breast health educators, and I take care of a lot of breast cancer patients. The other part I am involved with is a lot of cancer education. I'm out in the community making people aware of what we can do. So taking care of patients and teaching.
In your opinion and expertise, what has made the difference in the past 20 years in research and care to do such great work in the field of breast cancer?
Well, so many things have happened. We have over 14 million cancer survivors. 2.5 million of them are breast cancer survivors. It's early detection, it's people being aware of what their risk factors are, it's people sharing with other people that it's okay to get treated and to get their screening done, so it's people helping others.
Despite an increase in awareness to reduce the risk of breast cancer and getting screened early, which you mentioned, how does women now feel when she receives that call that no one wants to get, and how do they now cope with it?
Well, if you get that call that says your mammogram was abnormal, and that's probably the most common screening test we're doing with women in addition to pap smears for cervical cancer. If you get that call about your mammogram, the key is you have time to get good information. So you want to seek a medical center that has a team of experts. And one of the things that we've pioneered at Massey in this area, in this community particularly, is the multidisciplinary team. And so we have a team of doctors, including surgeons, radiation, pathologists, radiologists, all of the medical oncologists like myself. We all meet to determine the best treatment plan. There's no one size fits all anymore. Every treatment plan is different for each woman.
So that's a major advancement here at VCU Massey Cancer, because you're making it more patient-oriented and diverse by patient.
Very much so. It used to be everybody had surgery, then everybody had chemo, then everybody had radiation. The treatments have changed considerably. Sometimes now you start with chemotherapy, then surgery. And so you need to know what all the options are for you. So gathering information is the first biggest thing, not panicking, getting what you need to know.
A big event coming up, Women in Wellness. How can people get involved with this event?
Well, Women in Wellness has been going on for 20 years, so we're celebrating our 20th anniversary in February 2015. And it is a time where women listen to an inspirational speaker about taking care of themselves. They talk among each other, they communicate, they network, and they show that you can make a difference by being out there.
And again, that's some pictures here from last year. You can see this event here. This event, by the way, this year is on February 3rd, and we do hope you'd all come out and consider supporting this event. It really is, as you said, emotional and informational. You can find out more. It's being held at the Jefferson Hotel, massey.vcu.edu or massey.vcu.edu/women and wellness. We'd like to thank Care Advantage for making this Good News segment possible. Dr. Hackney, thank you.
My pleasure.